Welcome. Today we're going to go ahead and talk about instrument test 1. We're going to go over your major instrument set, the basic instruments. But before we can get into that, we really got to talk about why they're essential. Basic instruments are essential to accomplish all types of surgery. They are the foundation for creating instrument sets. They are commonly used instruments in all surgical procedures. We're going to begin by talking about clamping and occluding instruments. Clamping forceps. So the instruments I'm going to go over now are going to be the ones that we use for clamping, including vessels, veins, anything that we need to clamp or occlude. The first instrument that you'll see is your Kelly forceps, followed by your Rochester peon forceps, making sure that you pay close attention to detail when being able to differentiate between the two. Next is your mixer right angle forceps. So you'll notice that they are right angled. Most often you'll hear the surgeon say right angle, but I want you guys to understand that they're also called mixer right angles. Then we're going to get into our cutting and dissecting. The first one we're going to talk about is your straight Mayo scissors. We tend to use these most often to cut suture. Our Mayo suture or our Mayo curved scissors, however, are going to be used for cutting deep tissue. We have our Mets. I call these our workhorse. We use these all the time. They usually go hand in hand with what's called a DeBakey tissue forceps. We'll get to that later. But just know, when we're usually cutting through tissue, we tend to use our Mets and Bomb scissors. And then once the case is done, we use what's considered or called the Lister bandage scissor or bandage scissors. This is what we use to cut our drapes. If we're doing an orthopedic surgery, we'll use it to cut off our ace bandages or our splints or anything else like that. So we're going to change the venue just a tad bit. We're going to get into our cutting and dissecting. So I'm going to go ahead and give you a couple of the knife handles. The knife handles we place our knife blades on. You'll notice that you'll see a number 3, a number 3 long knife handle, and a number 7. The blades that we tend to load on those, you will notice, will be the 10, the 11, the 12, and the 15. We also have a number 4 knife handle. Well, you'll see a number 20 blade is the one we typically put on that particular. You're probably sitting here going, when, where, how, and why we would use different blades on different handles. Well, it all depends on the case, the surgeon, and what we're trying to fix. We have a beaver handle where it has a particular blade that will go in to the serrated areas and we spin it or twist it or tighten it in place. But we can't just cut. We tend to have things called forceps to go along with it that helps us to grab the tissue. Plain Adson tissue forceps. Grasping and holding. All of these forceps are used for grasping and holding different tissue and tissue layers. You have your tooth Adson tissue forceps, better known as Adson with teeth, followed by your Adson brown or brown Adson tissue forceps. You'll be able to tell the difference because when I look at the tissue Adson browns, I look at like there's a little brush on the tips, just little brush. Then we have our plain tissue forceps. They're just a little bit longer and thinner, followed by our tooth tissue forceps. Depending on where you are, I know at Rady Children's we call these our Gerald's with and without teeth. So you just have to know what are called at your facility. Our workhorse for forceps are our DeBakey tissue forceps. We use these almost in every case once we get past the skin and we're done with the Adson tissue forceps. If we're in ortho, the next two are the ones we tend to typically use: Bonney tissue forceps and Ferris-Smith tissue forceps. We use them because they are able to grasp muscle and tissue that needs a thick end. So if you look at them, they look a little bit more beefy. So your orthopods tend to use these a lot, especially in shoulders and hip cases. Then we have our Russian tissue forceps. You can identify these because they look just a little bit different than the rest of the forceps. I know that for me, I tend to use the Russian tissue forceps when I'm doing ACLs and we're taking bone chips because it has that little cup and we're able to place them into whatever we need so that we can accomplish the outcome. Now we're going to get into grasping and holding. The first thing that you'll see are your penetrating towel clamps. So the next ones are your non-penetrating towel clips. They're just like the penetrating, except they're not going to hurt the person. We tend to use these to clamp off our suction tubings and our bovies, anything that we want to make sure doesn't get contaminated throughout the case. We have our Forster sponge forceps, also used for grasping and holding, our Alice forceps, Babcock, Coker, Army Navy are our retractors. Retractors are helping us to visualize and help the doctor to be able to see what they're doing. Your Goulet, Synrix, used for smaller cases. One of the first cases you're going to learn is the breast biopsy. This is the first retractor that we tend to use in a breast biopsy. We have our Volkmann 4-prong retractor. Ribbon retractor. You ever heard about those cases where a patient has something lost in their body and years later it looks like a long retractor? Well, that's the one, the ribbon retractor. Once we get into the bowel resection, you'll learn everything you need to know about how to keep that retractor out of the body. Now, let's get into some self-retainer retractors. These are the ones where we don't have to manually hold for the surgeon. The first one we're going to talk about is a Wheatlander and a Gelpie. You'll notice that the tips are just slightly different. And a Gelpie, we tend to use these a lot in orthopedics, okay? Now, you're not done unless you can get all the fluid and blood that's in the body out. That brings us to our suctions and suction tips. The first one you'll see is the Fraser suction tip, mainly used in ENT in those smaller little cases, followed by your pull suction with guard or pull suction with tip. These are going to be the ones we use in those big belly cases when we're about to irrigate and get everything in there out. And our Yankar suction tip. You'll notice that with the pull and the Yankar, they are disposable on your sheets, but we do have non-disposable as well, meaning that they're metal and we don't throw them out. And once we've done all that, we've got to close the patient. So we'll need a needle holder, something to hold our suture in place. The one that you have that you'll be tested on is your Mayo Hagar needle holder. Okay, well, that is all that I have for your very first instrument set. Once you get into the lab, you'll also know that these are the instruments in your major instrument set. It is extremely important that you go back, review, and make sure you understand it because you're going to have an online quiz on the due date. Make sure you're looking at that lesson plan.